We are in the second year of the pandemic. India, like several countries, is witnessing an alarming rise in the daily COVID-19 cases, indicating a second wave of infections. Over 2 lakh people have been testing positive for the novel coronavirus every day for the last few days. Experts say the second wave in India is being largely driven by younger people, family, and group clusters. Many are showing at least 1 or 2 COVID-19 symptoms, unlike 2020, when more asymptomatic cases were being reported. Many with severe illnesses are turning to already overburdened hospitals. So it's more important than ever to understand the gravitas of the present situation and take precautions accordingly. Experts attribute the surge to people lowering their guard due to the lockdown fatigue and gathering in droves without wearing masks and maintaining a safe distance. Many experts have also attributed this to the recently detected new variants of the original COVID-19 virus. But is it a cause for concern? The virus replicating in the host cell of the infected person and undergoing changes or mutations during this process is not uncommon. The virus with one or more such mutations is called the variant of the original virus. Some disappear while others persist. Some of the variants that persisted have been detected in some countries while it spread to other nations. Currently, there are 3 variants of concern, while a double mutant variant first reported in India is a variant under investigation. B.1.1.7 was first reported in the UK, B.1.351 was first reported in South Africa, P.1 was first identified in Brazil. In March 2021, India detected a double mutant variant which has 2 different mutations. Among these variants, the B.1.1.7 variant and the double mutation variant are being commonly reported in several parts of India now. There is no definitive link between the current surge and the new variants just yet. But according to studies and experts across the globe, the B.1.1.7 variant is estimated to be more infectious and transmissible than the original COVID-19 virus. Latest Lancet studies add that the variant may not be deadlier than the original virus, although more research is required. Many of the COVID-19 patients are reporting at least one symptom, but not new or different ones. Some of the commonly reported symptoms are fever, cough, shortness of breath, sore throat, fatigue, body ache, diarrhea, vomiting, loss of smell or taste. It is also important to watch out for severe symptoms: shortness of breath, loss of appetite, confusion, persistent pain or pressure in the chest, high temperature. Contact your doctor or seek immediate medical assistance in case of these severe symptoms. The RT-PCR test is the gold standard to detect COVID-19. It includes nasal and throat swabs. The results could take up to 24 to 72 hours. Experts suggest taking the test on the 5th or the 7th day after exposure, since the viral load is generally at a peak then. Do not, however, wait if the clinical suspicion is high. The rapid antigen test gives results in 30 to 45 minutes and involves collecting nasal swab. If the test returns positive, the person has COVID-19. If it returns negative, the test should be followed up with RT-PCR test. RT-PCR and antigen tests are generally required for travel purposes. These are relatively cheaper than the other approved tests, TrueNat and CBNat. TrueNat and CBNat are comprehensive test systems to screen COVID-19. The diagnostic machine uses nose or throat swabs and the turnaround time is quicker. TrueNat results are considered true positive and true negative. Some hospitals use secondary lines of investigation, including CT scan and blood test, to confirm COVID-19. Many families of the COVID-19 patients in India are scrambling to get hold of the remdesivir vials. This has led to a shortage across the country. What is this drug and why is there an uptick? The remdesivir injection is an antiviral drug used for COVID-19 treatment in India. It helps in reducing the recovery process, but it should not be used as a standard COVID-19 treatment. According to the Indian Council of Medical Research, the drug is effective only if it's administered within the first 10 days of the infection. Wear a good mask, preferably the N95 masks, when in public spaces. Covering just the mouth or the chin will not be effective. Maintain a safe distance, at least 6 feet. Avoid public gatherings and crowd as much as possible, at least till the cases drastically subside. Carry a hand sanitizer when traveling. Wash your hands with soap thoroughly and regularly. Keep a pulse oximeter and a thermometer handy. But remember, an oximeter is not a substitute for COVID-19 test. It helps an infected person monitor the oxygen level and seek medical help accordingly. A safe level of oxygen or oxygen saturation is at least 95% or higher. Get vaccinated immediately if you are eligible. But remember, vaccination does not mean that you will not get COVID-19 at all. It helps reduce the severity of the infection if you get it. Besides, it takes at least 2 months after 2 doses for the vaccine to be completely effective. So it's pertinent to continue wearing masks, practicing hand hygiene, and maintaining a safe distance. This is Shubha Korean for the News Minute.